Talk to him. All right, well, good afternoon, everyone. Thank you for joining us. As you all know, our state, along with many other states, got hammered last night by the tornadoes. Certainly our thoughts and prayers go out to our neighbors and friends in other states, as well as our fellow Georgians. We experienced severe weather in multiple regions across the state last night, with tornadoes reportedly touching down in Catoosa, Chattooga, Floyd, Murray, Walker, Wayne, and Upson County. There are currently 59,000 Georgians without power. We have 49 who are injured, 23 homes that we know of that were destroyed, 59 other homes have minor damage, and there are 248 homes waiting to be assessed for damage. So far, we've confirmed that 7 Georgians have lost their life to this terrible storm, and certainly Marty, the girls, and my thoughts and prayers go out to them as well as their loved ones and their communities. Given the widespread impact, I've declared a state of emergency this morning for all 159 counties to facilitate the deployment of critically needed resources across our state. In coordination with private sector partners, GEMA, the Department of Public Safety, the Department of Natural Resources, the Department of Transportation, and the Georgia Forestry Commission are all working hard to restore power, clear debris, and provide assistance to the families in need. And I would ask everyone to continue to keep these individuals as well as their loved ones and those affected by the storms in your thoughts and prayers. We will do our part to help hard-working Georgians recover. As you all know, I got a look at some of the damage in Murray County today. I can tell you it is devastating. It looked like a bomb went off in 2 different neighborhoods I visited, and many of those Georgians are already suffering from being out of work due to the COVID-19 virus, and now they have literally lost everything that they owned. But I will tell you, they are strong-willed people. They are thankful that they have their families and their children. Unfortunately, some lost their lives, and we continue to keep them in our prayers. But with that resolve, with Georgia's resolve, I know that we will rebuild together what was lost. I'm going to move on today to the coronavirus update now. As of noon, we now have 13,315 cases in the state, spanning 157 counties with 464 fatalities. The state lab has processed 3,750 tests, and commercial vendors have processed 53,271 tests. Despite our partnerships and undeniable progress, our testing numbers in Georgia continue to lag. As I've said before, the status quo is unacceptable, and Dr. Toomey is pushing public health officials across our state to collect more specimens and to process more tests. This morning, Dr. Toomey held a conference call with public health directors in every region, directing them to expand test sites and revise current testing criteria. We need to be firing on all cylinders to prepare for the days and weeks ahead. At Dr. Toomey's direction, we are expanding testing criteria to include symptomatic critical infrastructure workers and asymptomatic individuals who have had direct contact with positive COVID-19 patients, including their family members. We will also continue to prioritize testing for symptomatic individuals with chronic health conditions, along with first responders, healthcare workers, law enforcement, and long-term care facility residents and staff, regardless of their symptoms. And although physicians can continue to refer patients to us for testing at public health sites, state officials can directly schedule people who require testing through local districts. Now, I want to be crystal clear. We do not want people showing up unannounced to a hospital, emergency room, or a healthcare facility for a test, you do need to contact your local health department beforehand to arrange for a test. While testing numbers continue to frustrate Georgians and state leaders alike, I am proud to talk about the progress that we have made to expand surge capacity. Over the weekend, the state executed a contract to build an alternative care facility at the Georgia World Congress Center. Yesterday, the Georgia National Guard, GEMA, the Department of Community Health, Department of Public Health, and contractors began preparing the site for potential coronavirus patient surge. Using the 200 non-ICU medical pods, similar to large cubicles with patient rooms, we will be able to house Georgians with mild to moderate illness. And, if needed, we can quickly expand capacity to 400 non-ICU beds. Our team will utilize contract medical staffing for the state's projected peak date, currently set for April 26, 2020, according to the IHME model. This project will leverage existing support through nearby Grady Memorial Hospital, with initial operating capacity available in roughly 1 week. We are grateful for our partnership with Grady under the leadership of John Hopper. This project will ensure flexibility and address needs as they arise. But this project, as you know, is just one of many that is underway to prepare for surge capacity in our state. Recently, we've secured commitments for many Georgia hospitals to convert hundreds of rooms into critical care space. Just a few days ago, Piedmont Healthcare announced an early opening of the Marcus Tower to bring 132 beds online, including 64 ICU beds for coronavirus patients. This expanded capacity at healthcare facilities across Georgia, and now with new construction at the Georgia World Congress Center, gives us the flexibility that we need ahead of the peak. And as you can imagine, in the aftermath of the severe storms as we saw today, this is a good example of why you need a facility like the one we are standing up at the Georgia World Congress Center. In coordination with the Georgia Hospital Association, we have worked to gather the most up-to-date information on bed capacity so we can continue to make informed decisions. As of today, we have 2,617 emergency room beds, 929 critical care beds, and nearly 6,000 general inpatient beds available statewide. By the end of this week, we hope to provide this bed capacity update daily to the public. For over a month, we've talked about our aging population, our most vulnerable in the battle against COVID-19. We have issued guidance and orders to protect these men and women, and we've taken measured steps to shield them from harm. Right now, there are at least 80 long-term care facilities, including nursing homes, assisted living facilities, personal care homes, hospice, and similar community living facilities with coronavirus cases. We are working to verify new information on additional facilities as we speak. To mitigate the spread of coronavirus in these facilities, I have charged General Cardin with deploying teams to those facilities to sanitize and train staff on infection control measures to stop further spread. Utilizing 60 infection control teams, the Guard has now cleaned 229 facilities. Right now, the Guard has 19 medical support teams, with most comprised of physicians, nurses, and medics working in hospitals to assist with the coronavirus triage and treatment. We have 60 service members working hospital entry at 21 hospitals and 27 service members deployed at state isolation sites. We also have service members stationed at 10 food distribution sites to assist with the delivery of goods. The Georgia National Guard is literally working day and night to keep Georgians safe. As I've mentioned previously, the state purchased 4 temporary medical units to expand bed capacity and strategically deploy them based on need. In Rome, we will have 1 unit operational by April the 21st. In Albany, we will have a 2nd unit operational on April the 28th. We will have 1 unit in Gainesville and 1 in Macon, both set to become operational on May the 5th. To quickly increase staffing in critical health care locations affected by the virus, the state has partnered with Jackson Healthcare, which has a portfolio of staffing, search, and technology companies to assist health systems, hospitals, and facilities with workforce needs. We're working through Jackson Healthcare's subsidiary, Healthcare Workforce Logistics, to bring roughly 570 additional healthcare professionals to key systems across our state. We'll be issuing a press release later with more information, and the state is creating specific guidance on how healthcare facilities can request this assistance. This battle against COVID-19, we have seen businesses, organizations, institutions, and Georgians from literally every corner of our state go and above and beyond to lend a hand. One great example is our world-class university system. Recently, Augusta University, the state's only public academic medical center, launched a web-based app that provides telemedicine screening of patients. With an app available on Apple and Android smartphones, this tool allows healthcare providers to interact with patients without risk of exposure. It's called the AU Health Express Care. If the result is a positive screening, further instructions will be provided on where to go for testing. Having tested this program in the Augusta area to 7,500 individuals, Augusta University is ready to offer this tool statewide. To access the app, go to augustahealth.org/COVID-19. augustahealth.org/COVID-19. For those without access to the internet or video capabilities on their smartphone or computer, you can call Augusta University's COVID-19 hotline at 706-721-1852. Again, that COVID hotline number for Augusta University, 706-712-1852. By leveraging technology and embracing innovation, we can ease the burden on medical facilities and provide patients access to the care that they need. To facilitate emergency response efforts and provide assistance to the communities in need, as you know, I have issued a multitude of executive orders. Earlier today, I signed an order suspending enforcement of Georgia's anti-mask statute so people can follow the guidance of public health officials without fear of prosecution. I want to especially thank Atlanta Mayor Keisha Lance Bottoms for raising awareness about this issue in our state. There are several other people and organizations that I'd like to recognize for their efforts behind the scenes. Once again, I'd like to thank Kevin Brown, CEO of Piedmont Healthcare, and his team, along with many, many other great healthcare professionals across our state, for literally working night and day on smart ways to increase our surge capacity in our state and keep our Georgians safe and happy, as well as healthy. They have really done a tremendous job of helping us with that, and I'm very grateful. I also want to thank many members of the business community, too many to name, up to answer the call to action in recent weeks. But a few, like Delta Airlines, which is providing free flights for out-of-state medical volunteers who are willing to travel and join the frontline fight against the virus. CVS Health, which we talked about last week, which helped us increase our testing capacity by 1,000 tests per day at Georgia Tech, like Home Depot, which is prioritizing shipments of PPE to healthcare workers. Shipments of PPE to healthcare workers and many other businesses who have completely overhauled their operations to provide resources and those supplies we need to frontline workers. I also want to thank our state and local law enforcement for their hard work. Many of these men and women, as you know, spent their weekend patrolling our beaches and parks, ensuring that Georgians were following the guidance. Many of these individuals were up all night last night following the storm and were on the ground working first thing this morning and still are today. I specifically want to thank Colonel Gary Val and the Department of Public Safety, as well as Commissioner Mark Williams and the Department of Natural Resources for working really hard this weekend in our parks and on our beaches, in many, many other places. I also want to thank Director Bryson and all the folks at GEMA that have not only been involved in the fight against the virus, but also working with us the last 24 to 48 hours to prepare and now to respond to these deadly storms, as well as Director Chuck Williams and the Forestry Commission, who has chainsaw strike teams and other men and women and equipment all throughout our state helping with the cleanup today, as well as Commissioner McMurray from DOT, many of his folks with saws, trucks, and equipment, and countless hard-working Georgia volunteers that are showing up to these damaged areas with a four-wheeler or a tractor and a chainsaw to help their fellow Georgians. I am grateful. Your state is grateful. And finally, on the heels of the Easter weekend, I want to sincerely thank our faith community in our state. This past weekend, for the first time in perhaps their history, many had to find new ways to worship during the most sacred time of the year to ensure the health and safety of their congregations and their fellow Georgians through online, drive-in, or call-in services. It was a great reminder that even though we must be apart right now, we can still come together and worship. And I want to thank those faith leaders for their participation this weekend. I know that was not easy. It was not easy for our family or many families across Georgia, but we are grateful for your commitment to your congregation, to your parishioners and our citizens, and to your faith. I'll now ask General Carden to come up and provide an update about what the National Guard's been doing, and then we'll be glad to take your questions. General.
Thank you, Governor. Good afternoon. On behalf of the soldiers, airmen, and members of the State Defense Force, I want to thank the Governor for the opportunity to serve, and I want to thank my teammates, Director Bryson and Dr. Toomey, as we continue to get after COVID-19. The Governor mentioned all of our mission profiles, and whether it's the 1,000 soldiers and airmen that are out working on infection control teams, or our medical support teams working in hospitals, or our soldiers, airmen, and members of the State Defense Force working in food banks to make sure Georgians get fed, or the ones that today started a mission here in Fulton County to make sure school children get their school lunches. We're eternally grateful to be able to serve our citizens, our governor, and our teammates at this critical time. As you know, the governor gave us a mission in DOD with the help of Director Bryson and Dr. Toomey, as well as the Department of Community Health, Commissioner Frank Berry, with respect to comparing hospital capacity to anticipated requirements. We're well into that. As the governor mentioned, at the World Congress Center, we have a team working that right now alongside the contractors that's been hired to put that facility in place. And so I just want you all to know that we're looking at the models, and those models are a decent guide with respect to balancing capacity and requirements, but it's not a foolproof guide. At the end of the day, we're in really good shape, not by hundreds, but by more than 1,000 with respect to beds, both ICU and general beds, when it comes to the median range that the models are calling for. But when you look at the upper bound range of the current models, we're not in such great shape. And so in looking at that and comparing it with the governor's mission statement that he gave us as a team, and that is to make sure that no Georgian suffers for the lack of being able to get to the appropriate level of medical care. I can assure you that this joint interagency public-private partnership will not fail our governor and will not fail our state. We believe that this facility at the Georgia World Congress Center will serve as a very important relief valve for the entire state should we run north of our surge capacity. And so that's what we're doing at the World Congress Center. We're going to work tirelessly to make sure that facility is in a position to serve Georgians. I frankly prayed that we don't need it, but I will tell you that it's going to be in place and it's going to be able to support you. It's going to be able to support your family at your time of need. Thank you all very much.
Great.
Governor, some state governors have talked about starting to ease limits to restart the economy. I know President Trump has also signaled his desire to get things moving by the end of the month or maybe early next month. Is Georgia ready for these types of discussions anytime soon? Have you thought about what's next?
Well, I think there's a lot of people in Georgia thinking about that, especially the people that are out of work. And I know how hard that is. But I would tell people right now, our focus is on the hospital's surge capacity, the ability to test more, because I think we're going to need that when we go back to work. I think, you got to look at where some of these governors are and what their state is experiencing, versus what we're looking at. I mean, we're a little behind the curve from when our peak's going to be to other states around the country, but that is certainly a day I am ready for. But I think today, specifically, we have been focused on the surge capacity, ramping up testing to do more than we're doing, protect those vulnerable populations that we have, which we know, just like every other state in the country, these folks that are in long-term care facilities, people that have pre-existing health conditions, and making sure that we're taking care of Georgians who are literally, their lives were ripped apart last night in that storm. That has been our focus today. We'll continue to talk about those things in the days ahead.
With the sense of urgency that you convey, need for expanding testing across the state, two questions. What are your goals? What are your expectations about getting this testing in place, and how quickly? And how can you eliminate the stay-at-home order on April 30th unless testing reaches a certain level, and what would that level be?
Well, I think the good thing is that we have more and more private sector companies that are coming online. I almost get a text from somebody every day that has a new, they're standing up a testing lab. That's certainly something I think the private sector is going to have to look at. We definitely got to do a better job here in our state. I'll let Dr. Toomey speak to that. She specifically has worked on that over the last 24 or 48 hours. But that's certainly something that we've got to continue to ramp up, and that's the questions that we got to start asking us when we get back to putting people back to work is, what is the new norm going to look like, for the immediate future anyway, maybe not for the long term when we get a vaccine or, some medicines that can deal with this, but certainly in the near term and the new norm, that's something that we're going to have to address, and a lot of other people are as well. And Dr. Toomey, do you want to add something?
I just have to say I really admire General Cardin more and more every day, not the least for the fact that he can stand at attention for hours at a time and not wobble like I do. So forgive me that I can't stand quite as erect as he does during press conferences. Now, thank you for the question, because this is something that clearly has concerned us. I too have seen the reports that we're number 45 out of 50 states in terms of our number tested. We know we need to ramp that up and ramp that up quickly. We're not the only game in town. Fortunately, many of the hospitals also have ramped up their testing capacity. In particular, thinking of Emory, for example, that has a high output machine that they have offered testing for others in the community as well, but many of the hospitals have testing. But all of our health districts now have multiple sites. We have over 34 at this time. We will have more before the end of the week that are run by the health departments statewide. And we recognize that we had probably made it a little bit too hard for people to get in because we were requiring people to get a referral from a physician. Initially, these test sites were set up to allow physicians to refer to us because physicians didn't want themselves to do testing in their offices. Now there's many options for testing in physician offices, but we also want to make it easier for us to see patients. And so nearly every district, and I think by the end of the week, all districts will have an opportunity for individuals to call the health department to schedule a time to come in and be tested, as well as to continue to take referrals from health departments and from other private physician offices as well. We have a number of labs we're using. We have a new partnership with a laboratory in Sandy Springs, but we also have ramped up the testing capacity using our university system and our state lab. That will allow us to do 1,000 tests a day. The private lab can do over 2,000 a day. We hope to get that to capacity and more very, very quickly. So thank you.
Just one quick follow-up, Governor Kemp. Does any decision on lifting the stay-at-home order or extending it depend in any part on the availability of testing? And again, what would be your goal? That anyone who wants one can get one?
Well, I wouldn't want to speculate on that right now. I think there's going to be a lot of moving parts that go into something like that. You know, anybody that's following, you know, the quote models that General Cardin mentioned knows that our peak date moves. It was on the 24th for the longest time, moved to the 20th. Now I think it's back to the 26th. So I don't really want to speculate on those things until we get to that peak, and then we can kind of see when we're coming off of this. I will tell you, we are seeing some good signs, which makes me just want to urge my fellow Georgians to get them to hunker down even more the rest of this week with all the things that we've been talking about: social distancing, good hand sanitation. You know, don't go to those large events. You know, over the weekend, unfortunately, we had to shut down a few parties that people were throwing in certain areas. We had a lot more problems at, you know, neighborhood block parties than we did on our beaches or in our state parks, and, you know, which is kind of surprising. Our faith community, as I said earlier, did a great job. It's just time to hunker down, make sure we can get to the peak, flatten things out, and then start going the other way. And then those are the things that we're going to have to really start answering and be very nimble, I think, at dealing with. And that's what Dr. Toomey's doing today. You know, our practices and our models and the things that we were doing a month ago, many of them we're not doing now. You know, nobody's ever been through this pandemic. Everybody's trying different things. Some are working, some are not. And I think we got to be nimble in the days ahead. But we do know we got to do this, and that is we have got to have enough hospital beds when we reach our peak. We've got to do more testing, and we've got to continue to focus on our long-term care facilities. As you all know, we've been talking about that for over a month. I was pleased to see CMS and Director Verma and the White House continuing to put out more guidance for transparency and making sure that we're all doubling down on this issue. We're certainly doing our part in the state with the executive order last week. Many of our long-term care facilities have welcomed General Cardin's team. They are appreciative of the help. We know that there could be staffing issues there in the days ahead as the workforce tests positive in some of these facilities. I mean, those are all the things that we are focused on today. When we get on the backside of this, I think we can start focusing more on the what ifs, or what does it look like, and Lord knows I'm ready to do that. But today we have to stay focused on the mission at hand.
Governor, the critical missing demographic information from so many of the public health reports you've got, 40% or more missing race and pre-existing conditions. How effectively are you going back and calculating, filling in those gaps so that we can know about all these cases that are confirmed, who they are?
Well, I'll let Dr. Toomey speak to the specifics of that. I know she has worked very hard to make sure when we put information out that it's been verified and it's correct. We also certainly in the long-term care facilities and other institutions, you have a next of kin notification that needs to be honored, as you can imagine, for the victims that have fallen to this. But there's no doubt that we need and continue to work on getting better data. I think last week Dr. Toomey said 60% of the people, we didn't have the racial makeup of the individual, and that's something, you know, when you look at who's being affected around the country and why, that data is important to us. It's also concerning, and we continue to work on that. Dr. Toomey?
Are you having success getting people out there who did not fill out the form completely to do so?
I think right now our priority is not retrospective, but prospective, ensuring that we proactively test, ensure we get fully filled out demographic information. I think for our staff to go back and find 12,000 individuals and ask them that information is less valuable to us now than very proactively addressing, you know, the way forward. And we are doing that. We have never collected exactly what the health condition is. I know some people expected us to have, is it diabetes or hypertension or heart disease? We didn't ask that. We asked, or were there some underlying conditions like those that CDC has noted puts you at risk. And so we have collected that information. You'll see more and more of that on our website. I hope you looked and saw that there's some additional information as a result of input from some of you, including some of our elected officials. And I really appreciate that, because I think it enhances the picture that we have statewide. Looking at where the cases are occurring by number doesn't give you the full picture. As looking at the map with rates, and then you see Southwest Georgia lighting up in a way that probably wasn't evident before when you saw those data on a table. So we are working very diligently to get all that information out. As much as we have, you will be able to access on the website.
So, briefly, who are the people that are not reporting those facts? Is it public health folks, or is it private institutions that are leaving blanks in those reports?
I think it may be private institutions and others. We don't know. And again, we can go back and retroactively do that. But as we ramp up our own testing, we will definitely ensure that drop-down box is checked for that demographic information. We can absolutely guarantee that our own team that's ramping up testing statewide will do that. And how the hospitals or the private sector physicians or the private labs are doing, I can't say, but speaking for our own team statewide, we recognize the importance of that and are really working hard to ensure improved data. But you know, for me, what was, as an epidemiologist, what I struggle with is not the lack of transparency, but recognizing that much of our data is not as accurate as it needs to be. For example, the data on race, when you have that many missing data points, it's hard to say what are the trends. And for hospitalized patients, it's much more accurate. And you'll see on our website, you now see racial data for deaths as well, which we didn't have before. And that those are much more assured, because we have that information on the death certificates. And so as we're moving forward, I want to be epidemiologically accurate, but I also want to be as transparent as we possibly can be at this time.
We've seen the fatality rate from COVID-19 in rural parts of Georgia be a lot higher than here in Metro Atlanta. What are some see for that?
Can you repeat the last question? I lost you there.
Sure. What are some of the reasons why the fatality rate from COVID-19 is higher in rural parts of the states as opposed to here in Metro Atlanta?
Well, I think, look, from me and from what I've looked at, especially where the hot spots are and issues that we've had to deal with in different communities across the state, you know, the Albany situation is just much drastic than anywhere else in the state, even though we've had other little smaller hot spots in places like Cartersville because of the church situation. But Albany, I mean, you had a super spreader issue there to, you know, trace back, I'm pretty certain now, to a large funeral. Many of the individuals that were at that service then attended another large funeral that same week, a big trial at the courthouse, and then the next thing you know, the whole community's blown up. I mean, people that were the services are working in the nursing home, the hospitals, and, you know, so I think that is one of the reasons that the rural numbers, especially in Southwest Georgia, are so bad. I did a lot of reading over the weekend on the people that are getting hit the hardest with this, and I thought it was very interesting. It differed a little bit in certain states, but cardiovascular disease, low immunity, a lot of the respiratory, pulmonary type issues, it's just hammering those people as well as the elderly, and especially the medically fragile who are elderly, like we have in our nursing homes and long-term care facilities. And that is one reason that we have been so focused on that issue and will continue to be in the days ahead.
Governor Kemp, can you give us an update on best practices and guidelines for schools during finishing out the rest of the year in terms of virtual learning, but also other supports like nutritional services? And does the state have supports for schools that might not have resources?
Yeah, I would refer to Superintendent Woods on the first part of that question. I'll be honest with you, I've been so busy dealing with surge capacity, storms, testing, and other things, I haven't really checked in with him in the last few days on the educational front, but I know there's a lot. And I mentioned this at the last press conference, there's a lot of great things going on. The other thing is a lot of school districts are in a really tough spot because of lack of internet access, which is a bad thing. The good thing is we're learning what everybody needs now. That'll be something that we'll be able to address and make us better in the future. I think as far as the school nutrition part of it, our local communities, the Guard, our school bus drivers, the folks that are working, the dietitians, people that are working in the lunchrooms in our school, they've done some incredible work. Our ag community that's getting hammered by this right now because of the lack of market, because of schools and institutions being closed down, is donating even as hard as they're getting hit. I want to certainly thank them for that, and I hope all Georgians will buy Georgia grown, support their local farmer. They are, this is the fourth thing in a row that's hitting our farmers and our agribusiness people. And I know we're going to continue to talk to the folks in D.C. about that as well on the fourth stimulus package. But I think, people are doing the best of what they got to work with. Good news is we're learning a lot. We're going to be better in the future because of it. And I mentioned last week that we are going to be standing the task force up to work on those issues in the days ahead.
Thank you.
Hey, Governor Kemp, Tyreek Wynn with Tyreek on the Move. I wanted to ask you, since I'm a student as well, do you think that we could see schools start on time? Because some schools in our state, lots of them start in August, some start in July, and year-round ones start in late June. So do you think that we could see schools start on time?
Well, that's certainly a little ways out considering other deadlines that we have before us, mainly the surge of the coronavirus in Georgia. But I do think that is obtainable. Whether that happens or not, it may or may not. I don't want people to think that that's etched in stone. It's certainly a great goal to shoot for. The response to many of these things, the way that the private sector has, come to the aid of testing, the speed that the Trump administration and those at FDA are working on treatments and other things, I think has been pretty remarkable from what I've seen on our calls. I didn't get to be with the Vice President on the governor's call today because we were in the air headed to Murray County to check on things up there. But, I mean, it gives you hope out there, and that is certainly something that we'll be discussing in the days ahead. And I know the conversations that we've had with Superintendent Woods and many of the school superintendents and administrators around the state, that is going to be an issue that we'll all work on together to make sure that we come up with good solutions, as well as the university system and others.
Governor Kemp, can we talk a little bit about the Windermere situation in Augusta? There was a situation Friday, about 70 patients there tested positive. What happens in a situation like that, a nursing home or a facility? How soon does the National Guard get deployed, and what are the steps in case more outbreaks like that happen in the state?
Well, I may let General Cardin give us a quick update, and then Dr. Toomey can add anything to that situation, because I know they probably have been up to speed on everything that's going on over there. General?
So thanks for that question. When we see a report like that, we go through and we index and look at the homes that we've already provided services to. And in fact, when we saw the report on that particular facility, we had been to it days before. And what we continue to do is to go back and recheck with facilities as we see problems or challenges out there to see if there's another service we can provide to them, whether it be training or, again, direct infection control. But I'll give you some anecdotal evidence. We're 13 days into this today. We deployed our first infection control team. Tomorrow will be 1 week, or 2 weeks ago. We went back this Friday to take a look at that particular facility in South Georgia. When we visited the first time, they had 23 positive patients of 112, and they had a number of others, the persons under investigation with pending tests. When we went back on Friday, they'd only had 5 additional residents test positive for COVID-19. Again, anecdotal evidence, but we're now able to establish some data points. We can go back and measure our effectiveness or the lack thereof and update our tactics, techniques, and procedures so that we can continue to get better and contribute more in this fight. And I'll turn it over to Dr. Toomey.
Thank you. And whether it's Windermere or any of the other homes that we have been involved in, it's often our local health directors and their team that go in first, are alerted, may go in and do testing. They may be in consultation with our epidemiology team, and we now have 4 infection control specialists on our epidemiology team for just this kind of activity. The health directors work with me directly, as well as with the epidemiology staff. And in the case of Windermere, I actually contacted Frank Berry as well as General Cardin to kind of do a full court press of all 3 of the agencies together to ensure that this is addressed. But this is the way we've been working throughout the state. But it's often our local health department that hears first, and maybe the first one to go in and do the testing, and then we mobilize the resources as needed.
And real quick, Dr. Toomey, while you're there, we've got a lot of questions about antibody testing and plasma testing as the race for the cure. Everyone wants to know, at least in Georgia, where do we see that timeline, and how do people, if they want to donate or help out with that, what can people do? What do we want to tell them for those who perhaps have tested or already recovered and want to help with finding a cure for COVID-19?
Okay, first of all, those are 2 separate questions. Let me just do the, if you want to donate plasma, I know Emory is doing a study right now, and I know several people who have actually donated plasma, and there may be other universities in the state as well doing those studies, and so I urge people who have successfully recovered from COVID to participate. The antibody tests are a more difficult thing because we don't really know if you test positive for the antibody if that means you're protected from future infection, and we're waiting for those data. And we will be working with some local hospitals to study that even as we go forward in these next weeks ahead, because that's really the question, isn't it? Does having it once mean you're protected for the rest of your life, or at least the rest of the season, or is it like flu, you can get it over and over again because it changes slightly? We don't know that. And right now our primary focus is getting the test for everyone who needs it, eventually opening up to everyone with symptoms right now, and as well as those at highest risk.
Governor, this question is from Raul Bali from the Oconee Radio Group. This weekend you wrote a letter to the staff of Central State Hospital in Milledgeville about the death of a second employee who had tested positive for COVID-19. 36 patients there at least have now tested positive, and staffers. Questions have been raised by the community about how COVID-19 was handled, especially after the first employee died last month, and how personal protection equipment was handled. Do you have a comment on how it was handled, the situation there, and do you have confidence in the leadership of the hospital and the Georgia Department of Behavioral Health and Developmental Disabilities, which oversees the hospital?
Well, I would refer, how that was handled to Judy Fitzgerald. I know she's been involved with that. That letter, I was simply signifying my sympathy to that group down there, how hard those folks are working in the hospital, and certainly if there's other details on how something was handled, we can certainly get that information. I wouldn't want to speak to that because I haven't had firsthand knowledge to that. I don't know if Dr. Toomey or anybody else up here. Yeah.
But to the folks who there in the local community who are concerned about just in general how it was handled, do you have a message for them?
Well, look, if somebody thinks something was not handled properly, we got the COVID-19 hotline. I'd encourage them to call that. I personally haven't heard from any of the folks over in that area about that instance from elected officials or otherwise. Doesn't mean that, you know, somebody hasn't been calling, but I have no firsthand knowledge of that, so I wouldn't want to speak to it.
Governor, the state had, before COVID, had a high rate of uninsured. And we expect with a lot of job loss that we're going to see that go up in terms of numbers. Do you expect higher Medicaid enrollment as a result? And what can be done with the uninsured who don't qualify for that? Is there any rethinking about the waiver or Medicaid expansion or anything like that?
No, we continue to work on our waiver and our innovative ways to tackle the high cost of private sector health insurance costs in our state. Also, reforming the broken Medicaid program that we've had for a long time, and I think our waivers are going to be very innovative in regards to that. Obviously, with the coronavirus, the task of our administration as well as CMS, and I don't want to speak with direct to Verma, but I know that they're all hands on deck from a national response to this virus as we are on the state, and those are things that we'll continue to look at and work on in the days ahead. Homer, you want to give a PPE update and equipment just real quick, and anything else on the storm today?
Good afternoon. We all know that this is a issue that no one thing can fix. Surge beds cannot fix it by themselves. Testing cannot fix it by itself. PPE cannot fix it by itself. But it's a combination of all of these working together to solve this issue and to move us forward. PPE continues to be a struggle for us. It's a struggle for every state in the nation. It's a struggle for the world at this point. But we've worked diligently with our federal partners. We have had some success with private vendors. We've been very fortunate with donations, and we're making strides in providing the PPE that's necessary for our medical folks and for our first responders. Regarding the weather this morning, unfortunately, the forecast was correct this time. Don't say that very often. But we had pretty confident predictions that there was going to be severe weather last night. We had separated our agency out of an abundance of caution because of COVID-19. We have people working in our state operations center working COVID-19, and we have other folks working remotely. We used our staff that were working remotely to stand up and operate a separate command structure and to partner with private, local, and other state partners to manage the weather event last night and into today.
Do we know how many tests are being done per day at the Georgia Tech drive-through facility?
I know they have the ability to do up to 1,000. I don't know if we have an update on that. Has anybody? Yeah, we can get that for you.
Okay, thank you.
Okay. All right. Well, thank you, everybody.